A loose tooth. What do we do about it? Why do people walk around with a wobbly tooth and do nothing about it? Is it possible to save such a tooth, or should it be extracted? Why do people have wobbly teeth in general? There are absolutely different reasons for this. The first group of patients with loose teeth is patients diagnosed with periodontosis. This is when there is a loss of bone and soft tissues, and absolutely healthy teeth begin to have mobility. That is, the neck part of the tooth is exposed, the tooth is visually stretched, and almost the root of the tooth is visible. Such patients delay the process as much as possible because they know very well that dentistry has not yet learned to fully treat patients with the diagnosis of periodontosis, and the only option for such patients, unfortunately, is tooth extraction and subsequently full restoration of chewing function with the help of prosthetics on implants or removable prosthesis. Some are simply not ready to part with their teeth, which have rarely been treated and seem absolutely healthy to them, only because they have mobility and, of course, maximally postpone the moment of extraction. Someone goes because of financial considerations, because they realize that it is quite expensive treatment, full prosthetics of the oral cavity. But there is a separate group of daredevils who seem to have no such global problems. They have mobility appeared only on 1 or 2 teeth, but they do not pay any attention to it and calmly go on. This is wrong. There are different technologies, techniques that will allow you to stabilize the mobility of the tooth and walk with it as long as possible. The first is splinting. You come to the dentist, and he, with the help of special tools and techniques, splints your tooth with the neighboring one, that is, connects them. This gives a certain stability to the mobile tooth. The pros of this technique are that you will walk longer with your tooth. The cons are that if splinting is the only technique you can use to stop the tooth from moving, you will most likely lose it in the long run anyway. If 1 or 2 teeth have developed mobility, you need to run to a periodontist doctor. This is a dentist who deals specifically with the treatment of the gums and bone tissue around the tooth. Yes, the causes of mobility can be different, but first of all, it is worth to go to a periodontologist because it is a narrow direction, a narrow specialization, which is designed to restore the tissue around the tooth. If you just walk around and do nothing, it is logical that after some time they will simply fall out. And it is for this reason that the issue should be approached comprehensively. After all, if there is a periodontological disease, such a situation in the future may occur on other teeth, and eventually you will be left without teeth at all. So you need to treat the gums, and the teeth will stop wobbling. What are some dental treatments other than splinting? In addition to splinting, periodontists have many different other tools that can extend the life of your teeth. For example, a machine like the Vector, which cleans the deep undergum area around the tooth and thus helps to restore the periodontal ligament. To make you understand, it is such a thin needle on which, with the help of vibration and ultrasound, is fed a special powder which polishes the neck part of the teeth inside between the gum and the tooth, where the primary infection occurs. And by cleaning this surface, the periodontal ligament is restored and the tightness of the teeth retention in the gum increases. But this procedure should be done exactly as recommended, not just because you decided to treat your gums. Periodontists also have various injections that they give directly into the gum to prevent the gum margin from further eroding. They can even take venous blood from you, run it through a centrifuge, and inject it back into the gum. Well, in general, there are a lot of techniques, and here you need to look individually at the indications and the diagnosis that you have been given. But most importantly, you should understand that, yes, maybe you will not be completely cured of these diseases, but at least 2-3 times slow down the rate of destruction and make it so that you pass with them, well, as long as possible. So if your tooth walks in your mouth, run to the doctor and be healthy. Thanks for watching. If you found this video helpful, don't forget to hit the like button and share it with your friends. Make sure to subscribe to the channel and click the notification bell so you never miss out on our latest health tips and tricks. Stay healthy and see you in the next video.